And get started, I have disabled the waiting room feature, so hopefully people will just be able to join as they are able to. So once again, thank you all for joining us today. My name is Maddie Curry. Thank you for joining us for our pre-application webinar called Supporting American Indian and Alaska Native Maternal Health through Tribal-Led Maternal Mortality Review Committees. So really quick, the National Indian Health Board, our purpose is to advocate on behalf of all federally recognized American Indian and Alaska Native tribes to ensure the fulfillment of the trust responsibility to deliver health and public health services as assured through treaties and reaffirmed in legislation, executive orders, and the Supreme Court cases. Our mission statement is we are one voice affirming and empowering American Indian and Alaska Native peoples to protect and improve health and reduce health disparities. So a little bit of housekeeping before we dive in. I ask that you please keep your microphones on mute. I believe you're automatically muted as you're entering, but if you could just keep those muted, I'd really appreciate it. Please save your questions until the Q&A portion at the end. And during that Q&A portion, you can use the chat box or your phone line for questions when prompted. Also, this webinar is being recorded, and if you can't, or if you have colleagues that can't make it to this webinar right now, we will send out an announcement when the webinar is posted on our website. Okay. So real quick for introductions, my name is Maddie Curry. I am the Public Health Project Coordinator for this project at the National Indian Health Board. I am a member of the Blackfeet Nation out in northwestern Montana, and I've been with NIHB for a full year now. And then I will pass it over to Nina.
Hi everyone, good afternoon. My name is Nina Martin. I'm the project manager overseeing a number of our maternal health related projects, including this one. So excited to have everybody here today to share this information about this opportunity. And then I'll pass it over to Sarah.
Hello everyone, my name is Sarah Zadunek and I'm also a public health project coordinator at NIHB. I work on this project with Maddie and Nina, and then also a brain health project. And I've been at NIHB for almost 2 years now.
Great, thank you guys. Yeah, so these will serve as your point of contacts throughout this project. And if you have any additional questions about maternal mortality prevention in Indian country or maternal health in Indian country, please feel free to reach out to us. We would be happy to, keep that connection going. So just a quick overview. So we'll start off with the project context and our goals for the project, and then we'll walk through the funding announcement. And then I will go over what a successful application looks like with this project, and then the next steps, what you are to expect after this webinar and after submitting your application. And then also we will end with questions and answers. Okay, so first off, we need to figure out and understand what a maternal mortality review committee is. So maternal mortality review committees are essentially multidisciplinary committees that exist in states and cities that perform comprehensive reviews of deaths among women within a year of the end of a pregnancy. So these committees can include representatives from the public health world, obstetrics and gynecology experts, experts in maternal fetal medicine, nurses, midwives, forensic pathologists, mental and behavioral health people, and patient advocacy groups, and also community-based organizations. Essentially everyone who could potentially be involved with, the pregnancy lifespan of a woman. And then with these MMRCs, the CDC works with them to improve and review processes that inform recommendations for preventing future deaths. So people on a panel or on these committees will take cases and review them and then make recommendations on how to improve and upon these prevention efforts. So where would maternal mortality review committees sit in the context of tribes and in Indian country? Well, that's where NIHB comes in, and we have developed this kind of idea of developing tribal-led maternal mortality review committees because we recognize that tribes are sovereign nations with distinct needs and governance, and tribes have specialized community-driven strengths and assets to improve maternal health outcomes, which we like to call protective factors. These protective factors can include community support, like close relationships with your family and your tribe, connections to your culture, which can increase resilience, including language and being involved in ceremony, and then your education, our schools, extracurricular activities that are crucial for community building, and then also the impact of positive mental health. We also, in the context of developing tribally-led MMRCs, we need to understand and address historical trauma and structural racism. These risk factors aren't necessarily included in your traditional maternal mortality review committee, which is why we are trying to give a tribal-led MMRC option to tribes, separate from, state or local government entities. So the project goal for this project is the overall goal of having a tribal-led MMRC is to support tribal entities in exploring the need and feasibility of creating tribally-led maternal mortality review committees. The National Indian Health Board is creating a tool and opportunity for tribes to participate in a self-assessment process to this end. So really quickly, NIHB has been working on this project for about 2 years, and we are now moving on from the development phase into the implementation phase, which is where the self-assessment process comes in. So now we'll move on into the actual tribal-led MMRC cohort. So really fast, I would like to direct everyone to to this URL right here. And Nina, if you don't mind popping that in the chat, I'd really appreciate that. I'd like to direct everyone to download the application package before I start walking through the package step by step. So if everyone's able to do that, or if you have any questions about that, let me know. So this is what the web page looks like under number 3, funding opportunity. If you go down to where this red arrow is, RFA for tribal-led MMRC self-assessment, that should be able to download as a Word document to your desktop, and you should be able to open it up from there. So if anyone has any issues with that, please say so in the chat or anything. I'll give you guys a couple minutes to do that. Alrighty, so hopefully everyone who's downloaded the application or who wants to has had the opportunity to. And let's move on. So within the application package, we have our overview. So NIHB is offering a funding opportunity for tribes and or tribal organizations to complete a qualitative self-assessment designed to assess the capacity and feasibility of developing and implementing tribal-led MMRCs. Our intended outcomes through this is having an understanding of the unique needs of tribes for maintaining successful MMRCs, increasing knowledge capacity in American Indian and Alaska Native maternal mortality prevention efforts, and increasing partnerships among tribes and tribal organizations for continued maternal mortality prevention. It's essential that we have tribal-led MMRCs that respect American Indian and Alaska Native culture, and through this, they may result in identification of meaningful and effective maternal mortality prevention strategies for tribes. The great thing about this project is that we are using these self-assessments to inform, and so along with these self-assessments, NIHB is also learning as we go for what maternal mortality prevention efforts will look like in Indian country based on the information gathered from the cohort. So to be eligible, to be considered eligible for this funding opportunity, the following criteria must be met. Applicants must be an official tribal entity defined as a federally recognized tribal government, tribal organization, or intertribal consortium as defined in the Indian Self-Determination and Education Assistance Act as amended. And then also applicants must have a strong interest and or demonstrated commitment to improving American Indian and Alaska Native maternal health outcomes. These strong interests, this number 2 is you'll be able to demonstrate that in the application package and under the project narrative. So for the availability of funds, NIHB anticipates funding up to 12 proposals in amounts of up to $7,500 each. Tribes must use these funds to conduct a self-assessment that will be facilitated by NIHB of their capacities for establishing, implementing, and maintaining a tribal-led MMRC. Tribes must also attend a virtual intensive training, which will be hosted by NIHB to build tribal-led MMRC capacity in Indian country. And this project period will be from November 1st, 2021 to July 31st, 2022. Why should you apply? So there will be consistent and continued networking opportunities with peers who are also engaged in American Indian and Alaska Native maternal mortality prevention efforts. NIHB will host learning community sessions about every 2 months that will provide opportunities to support peer learning around tribal maternal mortality prevention. Technical assistance through NIHB and partners will then elevate tribal voices, and then also participation, as I was touching on briefly earlier, the participation in the self-assessment will inform NIHB and partners on the best ways to approach American Indian and Alaska Native maternal mortality prevention. So if you're looking through the application right now, or if you've scrolled through, you might have noticed that there are several requirements that you might have additional questions on. So a complete application will have, again, your completed application package, which is sections A and B, and then also a completed scope of work, which is included in section B. This is your work plan with the assigned person responsible for each activity. A copy of scheduled findings from your most recent audit, a completed W-9, and then this is absolutely mandatory and required, a signed letter of support from your tribal health official or your tribal leader. So the application work plan, the good news is the work plan is pre-filled and the budget is predetermined. So your only job is to fill out the person's responsible column, and that is the column on the far right. And I have highlighted that with the red arrow. This is an example. This is just a screenshot of our activity 1 or objective 1 for your work plan. And so this is what it will look like. We can see that, you know, we have our creating a team, establishing your team description, obtaining your leadership approval, scheduling your regular team meetings to ensure successful project implementation. And then also there are several more activities with this work plan. So please make sure that as you're looking through the work plan that you have the capacity to complete all of the activities. Okay, we're almost there. So application submission, again, as indicated in the chat there, please download the application form on our website at the maternal mortality webpage. Again, it's under, I think, bullet point 3 or number 3, funding opportunity. It's right there. And please submit all your sections as a single Microsoft Word document and the signed letter of support from your tribal health official or tribal leader as a PDF. And then also please submit this application package by email titled Tribal-Led MMRC Application in the subject line to mcurry@nihb.org. That is me, and I will put that in the chat as well. That's me. And we're almost there. So some important dates to remember. The application due date is coming quick. It's due on Friday, September 17th, 2021 at 11:59 p.m. Eastern Standard Time. Please make note of that if you are in a different time zone. Unfortunately, we can't change that deadline. So Eastern Standard Time is I think it's like 9 Pacific, but and then so we have released the RFA. So a couple more important deadlines to make note of is the RFA was released today. So you are able to download that as on the webpage. And there will also be an email blast out if you aren't able to download it on the webpage for some reason or have missed it. There will be a couple of constant contact blasts. So keep an eye out for that. Applications again are due September 17th, 2021, 11:59 p.m. Eastern Standard Time. And then you will be notified of your award, whether or not it's been accepted or rejected on November 1st, 2021. That will be sent by an email from ideally from me, so keep an eye out for that. Whoever you submit the application to, my email, I'll let you know. Awardees must accept your award by November 5th, 2021. So again, keep that in the back of your mind. It's a tight turnaround if you are looking to accept that award. And then awardees will attend a virtual kickoff meeting hosted by NIHB on November 15th, 2021. Oops, sorry. And then also there is the intensive training that I mentioned as one of the required activities for the cohort will take place in February of 2022, and it's now decided that that training will be virtual. So then also the recommended deadline to complete the deliverables as outlined in the project narrative was June 30th, 2022. And then the end of the Tribally-Led MMRC funding cycle, as mentioned previously, is July 31st, 2022. So I will leave that screen up for just a second so people can write down these dates if they would like to. Okay. So that reaches the end of our pre-application webinar. It was quite quick. It's a pretty self-explanatory application. If you have any questions, please feel free to drop them in the chat or shout it out. That's a great question. So the intensive training will consist of peer-to-peer networking and also of some workshops and activities focused around maternal mortality prevention efforts in Indian country. This will probably include a list of guest lectures and guest speakers, as well as, identifying and assessing the current state of maternal mortality in Indian country, and also, talking about how we can improve on these processes. I hope that answered your question. Thanks. Oh, it's worth noting that the intensive training, even if you are not accepted as an awardee for this project, our intensive training will be intended to be open to the general audience for some specific portions of the training. So again, keep an eye out for communications from us around that as well. Any other questions? Yes, Catherine, the info to apply is right here. I'll just link it in the chat one more time for you. It's just on NIHB's website. And I'll go back to the slide that has what the web page looks like for you. So this is where you can find the funding opportunity, and then all the way down at the bottom, do we have any trainings on Indian health and views on pregnancy and maternity? And then, yes, just really fast. Okay, great, Catherine. So one of the questions is, do you have any trainings about Indian health and views on pregnancy and maternity? That is another portion of this project that will be developed through NIHB, is working on connecting with people about existing trainings and the existing work that's being done towards maternal health in Indian countries. So we don't have any specific trainings on that as of right now, but we will have those as we continue through this grant year cycle.
And can I add on to that? Is there anything in the works in terms of if there is an interest or capacity to do like a specific tribal MMRC, but to enhance tribal participation on already existing maternal mortality committees, or is this really just for new tribal specific ones?
So that's a great question. And so this is really for developing tribal-led MMRCs through the capacity of tribes themselves, rather taking away the kind of overbearing structure of state-specific MMRCs, if that makes sense. So we're really trying to, and that's what the self-assessment process will help inform us with, is what is needed to have and establish a successful tribal-led MMRC. So we don't know specifically yet, but that's what this will help inform us with. I hope that answered your question. Great. Yes, we're really trying to, you know, give our voices back to our Native women. And a lot of the times with existing MMRCs, that can be overlooked, especially with cultural considerations and cultural birthing practices. And so hopefully through establishing these tribal-led MMRCs, we'll be able to give our voices back, give Native women back to their voices.
And I just want to add on to that too. You know, we definitely acknowledge that there are many possible ways that an MMRC can run and look and include. And so that is, I think, one option that we have heard in previous meetings when we first were considering this project, is that, you know, we know a number of tribes work very closely with state level MMRCs and are engaged in that, and the inputs for that may look a little different. So we're certainly keeping our ears open as we go through this first year of kind of the focus on tribal-led MMRCs to understand what are some of those, you know, potentially common threads. You know, data access, we know, is one that will probably be across multiple different types of MMRCs. So looking to see what are some of those common inputs and threads that can that we can support, so that a tribe may be able to say, we want to run our own MMRC, we want to work with our area, we want to work more closely with the state and enhance that, like you said. So we are definitely keeping our ears open, and we're always, as Maddie said, you know, we're in the process of exploring this as well through this project. So we're always open to suggestions, questions, trainings that everyone would think are useful or needed. We're certainly more than happy to hear your ideas.
Thanks, Nina. Any other questions from anyone? Again, if you have anything, you know, I always tend to think of things like 5 seconds after the webinar ends. So please feel free to email Nina or Sarah or I if you have any additional questions. Oh, and I'll put my contact info right here. You can also give me a call, 202-507-4087. We'd be happy to address any questions that you have regarding the application or about NIHB's efforts in this. Alrighty, well, Again, as previously mentioned, this webinar will be recorded. If you would like to go back and reference it, we should have this posted by the end of tomorrow. If you want to go back and listen to my beautiful voice, but if anyone has any questions or anything like that, again, please feel free to reach out. We look forward to reading your applications. I'm so excited to be continuing to work on this project. This is also, you know, a passion project of mine as someone who has had their education in maternal child health. So we're very passionate and excited to continue along with this project. So again, I thank you all, and we will hopefully be in touch soon. Thanks, everyone.